Beautiful, Assistant Professor and Community Oral Health Department, School of Dentistry, Mashhad University of Medical Science. Dr. Hediyeh Toutouni, DDS and PhD. She's going to talk about preventing early childhood cares, regional experience based on worldwide goals. And after Dr. Toutouni, we will have ending ceremony with a fantastic family fun activity. Please stay with us. Over to you, Dr. Hediyeh Toutouni, please. Dr. Hediyeh? Yeah, yes. I guess you will get access now. It takes time to activate, I guess. Yes, yes.
Hello, thank you. Thank you for introducing me to the audience. Would you please start my presentation, please?
Yeah, sure, Doctor. Welcome.
Yeah. Hello and good evening to all our dear audience who are taking part in this conference in honor of Family Health and Fitness Day. Thank you for joining us here, and I would like to express my sincere thanks to the Executive Committee in Lilly Excellence Center who have provided this possibility of communication through a virtual platform during the pandemic. Well, in fact, next slide, please. Well, in fact, now I would like to talk about one of the most common chronic oral diseases worldwide, which according to the first ever United States Surgeon General's report published in 2000, is the single most common chronic oral diseases, albeit the first most costly one to treat, and it's 5 times more common than asthma in the world. What is this oral disease? It's dental caries or tooth decay. More than 2.3 billion people are suffering from dental caries in their permanent teeth, and approximately 530 million children are experiencing dental caries in their primary teeth, generally called milk teeth in plain English. Next slide, please. When dental caries occurs in the primary teeth of a child under the age of 5 years, it's called early childhood caries, which has been abbreviated to ECC, or rampant caries, because of its progressive nature. Now, the question is it preventable? The answer is yes, most likely in most cases. At present, there are several various methods of prevention available. Why only most likely and not definitely? The answer is acquisition of dental caries is multifactorial, which means it's completely dependent on multiple factors and more than 1 or 2 variables, of which I will talk about later. Why is prevention of ECC important in primary teeth? Parents usually tell us these teeth are not permanent and will soon fall out. But our answer is they will fall out much later, from 6 to 12 years of life. These teeth have great influence on the functions of a child's oral cavity, including chewing, speaking, and aesthetic appearance. In addition, a child's growth strongly impacted by their teeth functions, as children need to chew fiber-containing foods like fruits, vegetables, meats, and whole grain cereals. The front teeth usually fall out between 5 and 6.5 years of age, while the back teeth are usually maintained until the age of 12. Thus, we can see how important these primary teeth are for child's present and future health. It's related to the third goal out of 17 of Sustainable Development Goals, blueprint to achieve a better and more sustainable future for all from WHO. Many parents ask us how they can recognize the signs of ECC without visiting the dentist. Next slide, please. We first instruct them to raise the upper lip in order to examine those teeth. Dental caries first appear as white spots, generally appear on the teeth close to the gum, as you can see in the first photo. Any white spots, black and brown discolorations in the grooves would also be the start of dental caries. When parents see these signs, they should definitely visit the dentist. Let's return to our initial focus, which is how to prevent ECC. Next slide, please. First of all, one important way is not transferring the bacteria. Next slide, please. Transferring the bacteria, which is responsible for causing dental caries to the child's oral cavity through shared eating and drinking utensils or demonstrations of affection, such as kissing on the lips. For example, water bottles and drinking cups should not be exchanged between parents and or caregivers and child. As another example, testing the temperature of the food by parent or caregiver can certainly transfer the bacteria to the child. If caregiver or parent had dental caries or fillings in their mouth, the bacteria will be transferred to the child. Secondly, sugary drinks will precipitate the occurrence of ECC in children. For example, under the age of 1, bottles of sweetened water, tea, or juice should not be given to infants during the day, and especially at night, as the time for consuming this bottle is long and will create a sugary environment, which will lead to dental caries. After the age of 1, it's better to give the child sugarless drink in a cup. I believe it's important to emphasize that by not giving sugary drinks or food, we can help prevent the occurrence of 3 diseases: dental caries, obesity, and diabetes. Thirdly, biscuits, sweets, pastries should be given only one time a day, or even less, for example, 2 times a week. It's highly recommended to switch water after chewing these sugary snacks, which remain on the teeth for hours. In addition, if you want to give an apple and a cookie to your young child, it's better to give the cookie first and the apple after it. The order is important here. The fourth, brushing 2 times a day regularly has a crucial role to control dental caries in young children. 3 points are important: positioning, characteristics of toothbrush, and the amount of toothpaste. Arm cradling is the best position for brushing baby's teeth. As the child grows, the child can lie on the sofa and you can sit beside him, or the child can stand in front of you while you sit on a chair. The toothbrush should be small in its head, approximately 1 centimeter, with narrow tip to be able to clean all these surfaces. For infants, you can use finger toothbrush. Toothpaste should be used in a right size for infants, as you can see in the left photo. For infants and toddlers until age 2, and in a pea size for the children between 2 and 6. For the amount of fluoride in toothpaste should be consulted with the dentist. All above mentioned are keys of mitigating circumstances not only prevent ECC, but also to control dental caries in children even during the pandemic. Using toothpaste can reduce viruses in saliva, and brushing 2 times a day for 2 minutes with a toothpaste can lessen the virus transmission because of the ingredients commonly used in toothpaste and other detergents like soaps. And putting in a nutshell, the keys for preventing early childhood caries. The 4 B's, bacteria, bottle contain, biscuits and sweets, brushing teeth, and are keys of preventing ECC, whether it's a pandemic or not. And time and frequency of added sugar snack intake are another factors should be considered. Thank you so much for your consideration and paying attention to my lecture. If there is any question,
thank you so much, Doctor.
I'm here.
Thank you so much. It was a fantastic presentation. The best family awareness about child dental care and prevention medicine. Thanks a lot. Please. Thank you. Thank you.